And we're live. Hi, I'm Arthur Beem. And this particular segment I'm doing today is responding to, from a professional standpoint, to President Trump's executive order that to end crime and disorder on American streets is what the White House fact sheet says. And there has been a lot of, I guess you could say, turmoil about what he talks about reestablishing places for the mentally ill and getting veterans help, more help, especially the ones that are homeless and mentally ill as well. And I was astounded. I was very shocked as I looked through different responses. I'm not really sure why anybody would have a problem with this. I have approximately 30 plus years in hospitals, all kinds of different hospitals all across the nation, very high level ICUs, all the different ICUs, PCUs, ERs. I have a really well-rounded view. And what's really not noticed, what's not looked at, which most people breeze by real quickly, is I've had lots and lots and lots of patients that come in through the ER and into ICU that are homeless, they are drug addicts, they are frequent flyers, as they're called in the hospital, they're constantly there. And what we get to see on the inside is how these poor people, poor financially, but just sad situations, are dealt with social workers and dealing with all the issues and the problems. For instance, here's a perfect for instance. I had an ICU patient that was in ICU for probably 2 weeks. He came out of ICU and went into PCU, or progressive care, which is the step down unit. Once he got better to the state where he could be discharged, the case manager and social worker came in and were talking to him. Said, okay, so you're doing so much better. We got some orders for you to be able to be discharged and get your medications. And he stopped him. He says, well, I don't have any money for medications. Well, that's a problem. But the case managers worked it out with the doctor where they could go generic and they could get those medications like dirt cheap, super, super cheap. So that helped. But then they said, okay, so who can come pick you up? And the patient said, what do you mean pick me up? They said, well, to take you home. He goes, I don't have a home. They said, well, where would you? He says, and I don't have any transportation. And he said, well, you know that lot that's right beside McDonald's? Yeah, in the back of that lot, I have a place back there. So like house or no, it's not a house. It's just dirt, a ground. And I think he may have had a tent or something. So no transportation, no way to, and through his stay, you could tell there were mental issues, obviously, but because of his status of he had been into drugs before, he was just one of those frequent flyers, the cyclical patients that are like this. Years ago, my contract that I have now, years ago, before the institutions, the mental institutions were closed down. When they were closed down, all those people flooded into the system. And so now, instead of being helped financially with their medications, with their mental health, with a place to stay, they were dumped into the street. So they basically, there are just thousands of them now with no place to go. So what you're seeing now in the hospitals is during the winter, what happens is the drug addicts that they get cold and they're under a bridge and they're mentally ill on top of that come into the ER and they flood the ERs with fake symptoms. Some of them have real. I'm not saying they're all fake, but I'm saying there's a lot of fake symptoms because they know if they come in and say, "Hey, I have chest pain," and they know exactly what to say, that buys them anywhere from a 3 to 5 day stay of warm food, bed, shower, all the things, which is nice. But the problem is, think about what that does to the census of the hospital for people who do have chest pain, are having heart attacks, are having respiratory issues, and all these other things that are not seen or take literally days sitting in the ER and not getting any help because it's clogged with a lot of people who have fake symptoms because they need to get off the street. So this new bill that Trump did an executive order for is to help those people. For one, it helps mentally ill. It helps. Now, a lot of people are saying, well, it's too loosely interpreted. It's too loose. You're going to have abuse. Well, think about the abuse that's going on now. And how much are we loving those people and taking care of those people when we just let them lay on the pavement underneath some bridge somewhere? You have people that actually say that's well, they choose to do that. Well, that may be, but they get very sick, they get hurt, they get run over. There's all kinds of things that they harm other people. There's all kinds of issues with that. So this executive order is attempting to address those things. For instance, one of the headings is ending vagrancy and restoring order. As I read through the comments outside of this White House, what the White House had said about it, they're upset like it was attacking personal freedom and personal choice. And the vagrancy is happening with these people that are mentally ill. For instance, I had a patient just last week, same situation, heroin addict. He came in just completely wiped out. He came in, we took care of him, and it was just an abysmal mess for a week. I took care of him for most of that week. I was off a couple of days, came back, he was still there. Well, because of the way the system is now, he left against medical advice, walked out the front door, walked down the sidewalk, and then collapsed on the sidewalk, and they took him right back to the emergency room. It's situations like that that this is trying to help. Right now, nobody's trying to help it because our hands are bound by all the rules of social work and case management. And this is to actually restore that, to give us more things that we can offer these people, to help them with medical problems, psychiatric problems. It's not that we don't have psychiatric institutions, but from my years of experience, it's more difficult than you think to help them with that. Because all they have to do is say, well, it's like, for instance, it's a drowning man that doesn't understand what drowning is. And he just says, leave me alone as he's going below the waves. This is exactly what's happening with our meth addicts, with our heroin addicts. Heroin is just insidious. It's horrible. You're on heroin for very long. It really, really messes you up. Your whole system, I won't go into it because it's gross. But it's to help these people. That's what this is for. It sounds like it's loosely interpreted, but it's not. It's an ability to let us help them more easily and have a place for them to go and food to be able to feed them. Once they get outside the hospital doors, we can't do anything because of the insurance companies. The insurance companies have everything locked down. You leave against medical advice, that's it for you. All right. So as you look down, another part of it was ensure Americans feel safe in their own cities and towns. It's another problem because we have these same individuals. They are not, because of their mental illness, they can be violent, they can be scary, they can actually commit these things, and then they get thrown in jail, which we don't want that to happen. Why can't we help them before they get thrown in jail? That's what this is trying to help. That's one of the things they're trying to help. So making American streets and their neighborhoods safe. Yeah.
I have a question.
Yeah. Shoot.
So are you saying that right now that the only legal thing you can do is have them stay in a hospital or go to jail? Right now, that's their only.
Yeah, and what's happening is they know the right questions. So if I run them through a neurological exam, which is very short, what's your name? What's the date? Who's the president? There's 3 or 4 questions. That's it. If they can pass that, they can do anything they want, and that includes walking out the front door. Yeah. So another part of this is it's an addition, and it's not a small addition. This is a huge addition to me. He wants to make, and I can't tell you how many veterans I've taken care of that are homeless. They're mentally ill to some degree, but they a lot of them understand they are, but they don't know what to do. I don't have a job. I don't have any money. My leg is gone. My arm is gone. There's something going on with them that they can't just dive into the workforce and make 200,000 a year or 100,000. They have a very difficult time. And what President Trump said he wants to do is it's called National Center for Warrior Independence, a place where homeless veterans can go to receive care, benefits, and services in which they are entitled. See, as far as I'm concerned, if you were ever in active military, especially the ones that were actually in battle, you should never have to pay another dime of taxes, or we should take care of you for sure. And that's what this it appears to be. And I see a lot of people complaining about this. Oh, you're taking away autonomy. This helps everybody. This helps the person that's in dire need and dire straits with food, health, and a roof over their head. Because some of these people that have, in big air quotes, caused problems out on the street is because they get to a desperation level that they just lose it. Why can't we reach them before they lose it? Well, and I see this being a great positive for this, is to help those people who still have enough cognitive ability to be able to say, yeah, there's a problem. Please, I want help. Can you help me out? And for a place for them to go, a way to help them maybe get a job, to help them somehow and get them off the street. And of course, the other point that I already addressed is safety. Some of these people are mentally ill enough that they shouldn't just be wandering the streets, especially in the middle of the night, and then shooting up or whatever. I'm not saying they all do that, but I'm saying they're mentally ill enough that it makes it dangerous to go to the park, to walk in, just have a walk in your suburbs and your streets. It's gotten to the level to where these people need help. Why in the world? It's kind of like medicine in general. Our medical system's designed for pills after the fact, surgery after the fact, just like our RFK is doing now, is trying to have health ahead of time.
Preventative.
Why don't we do preventative health instead of after the fact? So that's what this is about. This is about doing preventative health for these poor people who don't have any of this stuff and no way to get it. I just think it's lovely. I think it's absolutely wonderful.
They can abuse the system,
yeah,
and cause the taxpayer.
Absolutely. The system can be abused now. And it literally costs the taxpayers more money for nothing. Absolutely nothing. The system's abused. Taxpayers pay more taxes, and there's no fix there.
And it clogs the system. So,
And it clogs up, yeah, and like I said in the very beginning, it clogs the whole entire system up in the hospital to where everybody's overworked. Everybody's just running to the ground, and a lot of it is these frequent flyers that keep the clogs clogged. Why can't we help them? And it'll help the hospital. It'll help those people. It'll help the stress of us who are working in there, because it is great. It can be a great stress on everybody, families and everybody. Any other questions you think you can add to that? But I think, please look at this. Please look at this. It's called the White House. It's called the White House Fact Sheet. It's super short. It's like one page, but it gives a nice outline of what it is, and it is a great start. Okay, there's not going to be any perfect solving. We obviously know that socialized medicine's a flop. There's people that think it's not. Let me tell you, it is a flop. It costs so much money, and the money just disappears into a black hole. So we don't want that for sure. So we have the greatest healthcare system in the world with its flaws. Even with its flaws, it's still the greatest in the world. So that's my 2 cents on that. And God love you. We'll talk to you next time. What do you think?